You've heard it, and you may even have it, the cough. It seems as if everyone is sick these days. COVID-19, RSV, the flu, and lots of viruses are keeping emergency rooms and doctors' offices busy. Just what is out there, and what can we do to keep ourselves safe? Joining us to help answer those questions is Dr. Ben Weston. He is Milwaukee County's Chief Health Policy Advisor and an Associate Professor in the Department of Emergency Medicine at the Medical College of Wisconsin. Thank you so much for joining us.
Well, it's nice to be back. Good to see you.
Good to see you as well. All right, help us understand this. What is out there making people sick?
Well, there's so much out there making people sick. You've probably had it. I've certainly had it. But what it is certainly varies. We definitely have COVID out there. COVID is at pretty high levels. We see that through our positivity numbers. We see that through our hospitalizations. Flu is also high and continuing to rise. Flu is probably what's rising at the fastest rate right now and continuing to increase here in Wisconsin. And then RSV, we're finally starting to see this plateau with RSV. So hopefully we'll start to see cases declining in the coming days and weeks. Now, we mentioned those three, but as we know, there's many other things out there. The common cold, lots of other viruses that are causing people to just feel crummy.
Well, let's tackle them one at a time. What is going on with COVID?
Yeah, so COVID numbers have been high for several weeks now. Luckily, they haven't been increasing. We've seen the positivity as well as the hospitalizations fairly steady, starting to just come down. We're at about 90 hospitalizations right now in the county. That's higher than we've been in quite a while, but it is starting to come down. We had 100 just a couple weeks ago. So those high numbers are starting to recede a bit. But certainly just from talking to folks around you, everybody knows someone who has COVID right now. It is certainly going around. I think the take-home points for COVID, number one, it's never too late to get vaccinated. If you didn't get that updated fall vaccine, that bivalent COVID vaccine, you can still do it. It'll still protect you. COVID numbers are still high, so it's still a good time to get vaccinated if you haven't done it yet. That's your safest, best, most effective, and least intrusive way to keep yourself and your family and those around you safe from getting COVID. The other COVID reminder I would say is Paxlovid. We kind of forget about these antiviral medications, but for folks who are at high risk, if you get COVID, you want to think about getting Paxlovid as well. Talk to your doctor, talk to your pharmacist about whether you would qualify for it. But if you get this medicine early in the course of disease, before you're really feeling sick, it'll prevent you from getting very sick, prevent you from getting hospitalized, and even worse.
Well, and as you said, it's one of those things that you can do that can help you. People aren't necessarily getting as sick as they did with previous variants, but you can still get sick.
Right, and especially for people who are more medically vulnerable, if you have immune compromise, if you have lung disease, if you're just older, you're more likely to get quite sick from COVID. And so taking that medicine, taking Paxlovid, and not taking it once you start to feel really sick, you can't wait that long. Then it's too late. You got to really take it in the beginning of your illness when you're not feeling that terribly sick, but you know you're COVID positive, to have it take effect and prevent that increased, worsening of symptoms.
RSV, we're getting a little bit of a break with that. It's not continuing to rise as much, correct?
Right. We've had a pretty typical RSV season, actually, which is good. That it's not worse than in the past. RSV tends to affect the very old and very young the most. And we saw that again this year. We saw RSV hospitalizations and cases rise. And now we're starting to see them plateau and go down. So it's been kind of a pretty standard RSV season. Now, we did have this new RSV vaccine that's available that protects the most vulnerable folks, whether it's, little babies or whether it's older folks. So that was certainly an additional tool that we had in our toolbox, but a pretty typical RSV year.
Are enough people getting the vaccine, and can you still get it, or is that window passed?
Yeah, so people can still get the RSV vaccine. We're getting to the end of the RSV season. So if you have to choose which vaccine to get, I would certainly focus on COVID and flu right now, although they're not exclusive of each other. So you can get all your vaccines still. But I think we're getting toward the end of RSV season here.
That's one bit of good news. The flu,
Right.
though, a little bit of a different situation. Where are we in the biosphere of the flu season?
Right. So flu was rising pretty quickly over the last few weeks. The numbers had a little bit of a reprieve over the last week or two. Unclear if that's just because of less testing over the holidays, or what that was. But we'll look at the next couple of weeks. I think we're probably still seeing a bit of an uptick in flu cases. Probably have a little bit longer until we start seeing a leveling off there. But flu is definitely still around. I'll tell you, when I'm working in the emergency department, we're seeing lots of flu. We're seeing lots of COVID. And so it's, again, not too late to get vaccinated, especially if you're in a higher risk group. Flu is going around, and that vaccine is definitely protective.
It's interesting that you say when you see flu in the emergency room. I don't know if it's because we think we're hardy Wisconsinites or what it is, but I think most people still don't understand how sick the flu can make you, and it can make you sick enough where you end up in the hospital.
Absolutely. Many people every year, not just this year or last year, but for decades, many people get very sick with flu, get hospitalized with flu, and unfortunately die from flu. And it's such a shame because it is such a preventable condition. Now, the vaccine for flu is not perfect by any means, but it's a lot better than not getting vaccinated. You're less likely to get it. You're less likely to get severely ill from it. And so it's a really important vaccine for everyone to get, but especially if you're in that more vulnerable population.
So there's still some vaccines that we can get, particularly COVID and the flu. Can you get both of them together?
Absolutely. Yep. You can get both vaccines at the same time. Get it done. If you feel a little crummy for a day afterwards, you can combine that into one and get that protection from both.
Now, one of the things that is happening is there are lots of viruses around that are out there. We can't have immunizations for those. What can people do to help keep themselves safe from viruses?
Yeah, so certainly get the vaccines you can, get protected where it's possible. But there's a lot of things out there you can't get vaccinated against, the common cold, many other viruses that are out there. In those cases, the main thing is rest, hydration, and trying not to spread it to other folks. Nobody wants you at work if you're coughing and sneezing all over the place. So just, if you can, stay home, stay away from others, keep to yourself until you get a little bit better. Try to avoid spreading that to others.
And the tips that we learned during COVID as to how to keep ourselves safe from COVID, are those still good tips for us to use for COVID and RSV and the flu and all these viruses that are out there?
Right, absolutely. Taking just basic hygienic infectious disease sort of precautions. This means washing your hands. This means or using hand sanitizer. It means covering your mouth when you cough. It means staying home when you're sick. These are going to prevent all sorts of different communicable diseases, all of these different infectious respiratory diseases and GI diseases, all the things that none of us want to deal with. We can make it less likely to deal with if we take precautions for ourselves as well as for others.
One final question. It's a little bit controversial still. What about wearing a mask during this time of year? Is that something that can be helpful, or is that just something that isn't necessary?
Yeah, I mean, here's what I would say. I would say if you're going to wear a mask, wear a high quality mask. We're talking about a KN95 or N95 mask. Wearing cloth masks or simple surgical masks aren't going to be terribly effective right now. I think we have to be realistic and understand that, we can say everybody should wear a mask. It's not going to happen. But for certain folks in high risk situations or in certain settings that are higher risk, it is important to wear a mask. And when you do, wear a high quality mask. I still wear a mask every time I have a patient encounter in the emergency department. When I walk into that room, I put on a high quality mask because I know I'm around somebody who's inherently more vulnerable because they're there in that emergency department. Now, secondarily, they're also there in that emergency department. I see all sorts of folks coming up with flu and COVID. So that's another good reason why I wear a mask. I don't wear one in all settings, but when I'm in those sort of high risk settings, I do.
Well, thank you as always for the advice, Dr. Weston. We appreciate it.
Thank you so much. You take care.
You too. We will be back in just a minute with details on how you can save a life.